Are we ready to go?
Simon, we can go.
Good day, everyone, and welcome to this edition of Black Health Trust. And now I would like to turn the meeting over to our founder, Dr. Randall Maxey.
Good afternoon, Dr. Walks and Dr. Hines. I appreciate everybody joining us today. We're going to have a lot of fun today and discuss some of the events that have happened over the past 24 months. So everybody knows that Dr. Neighbor Stevens is one of our major panelists. She happens to be in Sweden today. I hope she can still join us. I know it's late at night for them. And Dr. Hines has been a trooper with us for many, many months, and Dr. Walks. Uh, but today I want to add to the panel for discussion today Dr. Lawson, when he joins. And I've also invited a registered nurse who happens to have the same first name I do. Her name is Randall Romero, and she's a nurse in Dutchess County in New York. And I'd like her to join our discussion group. And we're going to review some of the major events that have gone public into our health system over the past 24 months. So Simon, if you put the first slide up, I'd like to start a discussion. And we're going to have on each slide that we go through, we're going to ask for feedback from the audience. And I'm going to ask my co-moderators to, as usual, help me with the slides, but I'll take the first one. If you put it up, Simon, please. So I want to take this brief moment until the slides come up uh, to notice that a good personal friend of mine is Dr. Jose Colon, who is a nephrologist, a kidney specialist, specialist in internal medicine, and a medical director of one of the dialysis units that we have in Puerto Rico. Transitioned yesterday from prostate cancer. And that's one of the things that we're going to talk about is with all the screening that we have and able to diagnose early, that we need to be aware that disease does kill, and early is better than not early. You have the first slide up, Simon? So I'm going to use the word epigraph, and I'm going to, if you can make those a little bit bigger for me. Some of you know I do have a sight impediment. So the word epigraph, I'm going to talk about something. And for the past few years, I've been concerned about this word that has showed up on the political spectrum of called woke. And woke is a simple past tense of the word wake. As an adjective, it's an active awareness of systemic injustices, especially when involving one's treatment and results in life and health and possibly death. Slang wise, it's interpreted as being aware of facts, of the true situation around you. And one of the things that I'm going to encourage our community of color from this point on, if not before, be aware of your true situation. All the politics, all the money in the world, all the Democrats, Republicans, and Green parties don't mean anything if you're not alive. And we're going to talk about some of the things that will keep us alive. Let's go to the next slide. And Dr. Walks, I wonder if you take this first slide.
Absolutely, Dr. Maxey. Thank you. So, Emerging Layperson's Guide. Purpose is to understand key health issues affecting individuals and Black communities in 24 to 2025 to empower individuals to make informed decisions to protect themselves and their families.
Let's go to the next slide.
All right.
Good.
So the topics that are going to be covered are heat, climate change, and personal health, cancer in younger people, microplastics and health risks, ultra-processed foods, food and Alzheimer's disease, obesity and brain health, and parental stress.
Next slide, please, Simon. Go ahead, Evan. You can do this one.
Okay, I have a little bar at the top of my screen here, and I think other folks may have that too.
Does heat
It,
and climate change a growing health concern?
okay. Heat and climate change, a growing health concern. Key points. Point number one, global warming. The planet is getting hotter. Okay, now I have another. Okay, which leads to extreme heat events. Health risks. The little black bars are gone. Thank you, Simon. Health risks. Dehydration, heat stroke, heat exhaustion. Bullet number two, increased cardiovascular and respiratory diseases. And bullet three, vulnerable populations, elderly, children, those with pre-existing health conditions. So that's all of us, right, Dr. Maxey?
That's
You're
right.
talking about children, elderly, and those with pre-existing health conditions?
Yes. So we've talked about everything that we've talked about on this slide, we've talked about before, but I just want to emphasize that these are things we brought to the forefront. And I'd like our co-moderators just to add some color to it, no pun intended.
Yeah, I will just add to the health issues that we're talking about. I mean, that's everything from, because some people think that the climate change issue is still in the future, but it's very much present. And that's impacting, some of the pollen counts that some people may be experiencing, the worsening air quality on both coasts. In this past year, we had big issues with dense smoke and stuff like that impacting states, far beyond where the actual incidents were, causing respiratory issues for people, the extreme weather events, the hurricanes, the floods, the fires, right, which cause not only damage to home, it costs lives, it's costing our economy money to deal with the disasters, the increased healthcare costs, infrastructure repairs, their agricultural impacts. Over the course of this year, we saw multiple different agricultural issues with far as, what crops weren't growing. There was a potato shortage, so there was a French fry shortage for a while this year that I can remember. So, and then just all of the mental health issues as far as stress and anxiety, especially that younger people have around where is this going, right? What are the long-term effects, and how come we're not doing enough fast enough for some people?
And and let me add to Dr. Hines' comments. The other thing about more heat is more infectious disease, more mosquitoes hanging around longer. So there's a lot to this.
And diseases in areas that they're not typically known for,
Mhm.
which
Yeah.
which then means people aren't, individuals aren't as innately immune as they might be. Providers may not have ever seen that before and don't necessarily know how to treat those things. Like it's already changing things now.
So the other thing I noted that there was a big problem with organic foods this year, carrots and cabbages, and there was a lot of listeria infecting some of those things. So we need to have food cleanliness and know how to appropriately clean food before we eat it. And there was a problem at McDonald's too, I think. Am I right?
Yeah, McDonald's had a problem with the onions. Yep.
Yeah.
Causing
Yeah.
the onions specifically on their quarter pounders, I believe, on their burgers, so to speak, caused an outbreak. I learned a
Dr.
lot about the fragility of certain types of plants, that they need a certain number of cold days. A lot of the underground plants need a certain number of cold days to, you know, grow like they're supposed to.
Okay. Is Dr. Lawson on yet?
Do not see Dr. Lawson yet.
I'm going to ask Ms. Romero to introduce herself very briefly. She's a registered nurse. I want her to comment on this slide as well.
Hi, my name is Randall Romero. I'm a registered nurse. Thank you very much for allowing me to be in your company. I feel very privileged. This slide is very concerning to me. It has so many implications that are important to all of us. We talked about food cleanliness. But as you know, the climate changes and you start to see food shortages, and especially in vulnerable populations. So that's definitely a concern I would talk about.
Well, thank you so much. Let's go to the next slide, Simon. Can you make that change?
Okay, so heat and climate change, a growing health concern. Slide number 2. Actionable advice. That means this is stuff we should be doing, not just listening to and hearing about. We should be staying hydrated. We should be avoiding outdoor exertion during peak heat hours. And we may not think about that right now in Maryland because we're not having any peak heat hours, but people travel over the holidays. And you may go to a place where it's warm and then call back and tell me that it's 80 degrees where you are, and I'm upset. But when you get to where it's 85 and 90 degrees, remember, avoid exertion during peak heat hours. Use air conditioning, fans, wear loose clothing. Understand the importance of cooling centers in your community. And this one ties a lot back to previous discussions about some of the extreme weather events. We may not ever think about, I've got to go to a cooling center, I've got to go to the gym that our community has set up for people to go to, or maybe a movie theater that may have the ability to maintain a cooler temperature. I know in Washington, D.C., during extreme times of heat, they've pulled buses up in some communities so folks can go and sit on the bus and be in a cool place. But this is really a big deal, knowing where a cooling center is and making sure that your community has identified places for you to be cool.
I want to talk about that first point, Dr. Walsh, staying hydrated.
Ah,
Many people don't know that just by breathing and walking around, you lose almost 1.5 liters of fluid every day. That doesn't even necessarily count you urinating. just from insensible sweat and from the moisture that leaves your body when you breathe out, that's 1,500 cc's. That's roughly a gallon and a half. So when you're drinking water, keep that in mind. Not only do you need to drink what you urinate out, but you need to over that by how much you lose through your skin and through your breath. So everybody should be drinking in excess of 2 liters a day of fluid, more for time. Stay hydrated. That is the cause of so many different diseases and problems that people have. Any thoughts on that, Dr. Hines?
I would only add to, in the broader context of this discussion, pay attention to your weather reports. Because I think for a lot of us, we don't, take certain things seriously. Oh, we've never had tornadoes here that are a big deal. We've never had hurricanes here that are a big deal. And I would just say that things that didn't used to be true are becoming more true. I think we had to get in the basement 3 times this year, right? And that's not a norm I'm in Maryland. That's not a norm for us as far as significant tornado warnings. And we had significant tornadoes in our area this year. So just pay attention to the weather report sometimes, and then, think clearly on what you're gonna do with the warnings that you're given.
Yeah. Ms. Romero, you have teenagers, right? How do you talk to them when we have these heat emergencies?
Well, again, the importance of staying hydrated is so important. We can't stress that enough. Working on a med surge unit in a hospital, so many of my patients, especially the vulnerable elderly, end up in the hospital dehydrated. So, we're always trying to find out what kind of resources they have. Remind them to drink. Also, asking questions about what they do know about what kind of resources are available in their community. And if they don't know, getting case management involved and having it be much more of a collaborative experience, so that we can have better outcomes.
So let me add to that, if I may, Dr. Maxey. This whole thing about staying hydrated is really a big deal because folks can become dehydrated for a number of different reasons. Um, for example, if someone has a problem with frequent urination and they don't want to drink a lot because it means they'll have to go to the bathroom, though that's a real thing for a lot of folks, especially for senior men. And so two things. Number one is you can get dizzy when you're dehydrated. You can decide to stand up and fall over. And so now you combine someone who maybe because they're a senior isn't as able to ambulate or walk around as well as they used to, and then they're dehydrated and dizzy. That's just a bad combination. It's a fall waiting to happen. And then falls are only good for toddlers. Once you get over the age of 2, falls are not a good idea. You don't learn anything. You learn a lot from falling when you're really, really young, but once you get a little bit less young, falling is not a good idea. So think about staying hydrated, not just because maybe it'll keep me able to walk around when it's hot, but even if you are in a cool climate with no heat concerns, being hydrated is important because it's one of the key things that can make you stand up and get dizzy.
And just to add to that, because lots of people don't realize that they're dehydrated, to your point, Dr. Maxey, about the water that your body loses without you noticing. There are several different things you can do to check to see if you're dehydrated, but look at your urine, right? If your urine is dark gold or bright gold, you're dehydrated, right? The goal should be light yellow like straw. That's the ideal place that says that you're in a hydrated place. So that's, and some chapped lips is one, but that can come from another of other reasons too. But that urine is a telltale sign of where your fluid status is.
Okay, thank you so much. Let's move to the next slide. And what I want to start doing after each one of these slides, we're going to ask for audience participation to comment on some of this. This is not a one-way thing. We want our members to comment, and not only in the chat, but I want Simon to unmute some of them so they can comment. You want to take this one, Dr. Hines?
Sure. There's an increase in cancer among younger people. So cancer rates in the younger population, and younger population, we're talking about individuals less than 50, are increasing in things like breast cancer, colorectal cancer, and skin cancer. And what we're finding out is there are a lot of factors that are playing in. Your genetics, what you inherit has always been on the table. And it's not something that you can do too much about, but you can know that you have those risks. And in particular, breast cancer and colorectal cancer are ones where you can know what your family history is and decide, to take certain actions. But then there's a lot of lifestyle factors that are increasingly coming up as risk factors for some of these. And, as far as diet, alcohol consumption, lack of exercise, inflammatory foods and agents, environmental toxins. And then, of course, there's the impact of delayed diagnosis, which is of particular concern to, the minority community for all the reasons that we've talked about throughout this year and prior years on this program. Reasons why people don't go to the doctor, don't want to engage with the medical system. Those things can lead to delayed diagnosis. The consequence of a delayed diagnosis is just like everything else. If you don't treat a problem when it's small, treating it when it's bigger is sometimes more challenging, more costly, more longer, and sometimes there's nothing we can do about it if you wait too long.
Let me ask a question, and I want some audience responses. But Dr. Hines, for example, what are some of the major things that patients need to do in terms of women? When should they start having mammograms? When should men start having prostate exams? When should people start having colonoscopies? And when should people start having pap smears? Those are 4 big things that we need to put on people's mind for early.
For breast cancer, the current recommendation around breast cancer is to start getting mammograms at age 40. It used to be at age 50, and that is for people who are at average risk, right? So it's 40 for average risk individuals instead of 50. And then, and sometimes depending on if your family history, you might even be recommended to get them even earlier. As for colorectal cancer, it used to be screening started at 50 unless you had a family history or something that put you at increased risk. And then it was 10 years before then, right? Now, the current recommendation is to start at age 45. And again, that is for people who are at average risk. And at 45, if you're at average risk, you can kind of start with some of those, those things you're seeing in the mail, the Cologuards and things like that, where you send in the stool samples. But by 50, for sure, the gold standard is to have a colonoscopy. But overall, you're starting screening at 45. Cervical cancer, the recommendations for cervical cancer haven't changed too much. It's still start getting pap smears at age 21 and then continue for every 3 years. And then when you are between ages 30 and 65, depending on your personal risk factors, then it's around every 5 years. And then after 65, because one of the things that is also a factor is people are living longer in some contexts too, right? So the question gets to be how long to continue to do cervical cancer screenings. And after 65, that's a space where you and your doctor would talk about, your individual risk factors, your lifestyle, those kinds of things. Skin cancer. So with all the things that we're talking about sun exposure and climate change, regular skin checks by a healthcare provider are recommended, especially for those who have a history of sunburns, who use tanning beds, who have a family history of skin cancer. Sometimes we don't think that that's us, but melanated people get skin cancer too, right? And then you asked about, so while we're talking in the men's space, so there is no testicular cancer screening test, but men are supposed to do regular self-exams, similar to what women are supposed to do as far as breast cancer is concerned. And then testicular cancer diagnosis, unfortunately, is also on the rise. As it relates to prostate cancer, there's never been at least not for a while, a uniform answer to this question. But at around 55 or so, is when you and your provider want to start talking about, PSA screenings. PSA stands for prostate specific antigen. It's a blood test that your provider would use to kind of as a marker for signs of elevation. And then in general, those can be done annually in conjunction with a prostate exam, because a screening test is just one step. An actual exam, especially in the case of the prostate, is really critical to understanding how to interpret sometimes those elevated numbers. And then after about the age of 70 or so, again, similar to what we were saying about cervical cancer, the how long to continue screening for becomes a question for you and your provider. High
Well,
risk groups, again, are African American men are in a high risk group in general, and sometimes they're recommended to start as young as 45. And then those who have a first degree relative with prostate cancer are recommended to start at around age 40.
that's exactly what I wanted you to say. Dr. Brian Stone has spoken extensively to us on this to make sure that men start early. And if you have a father, brother that has prostate cancer, your risks are up significantly to do that. So you need to, again, when you have these family reunions, talk about who has what and what problems. It's a good time to communicate with your family and know what those risks are. And this lifestyle is so important. We know that everything that you eat and do and consume has something to do with your present and future health. So that's so important. Any other comments on that? Let's ask in our audience if anybody else wants to comment on the fact that cancer is occurring earlier in younger people. Have you seen this in your communities or in your family? Is there anybody whose hand is up? Nobody. Okay, let's go to the next slide. Thank you, Dr. Hines.
Sadly. And then as far as things you can do, again, like we talked about, following the recommended screening schedules based on your risk factors, and just being aware that for those of you that don't have a PCP, because I'm not that old yet, that the age where you've got to start taking some actions on some things is getting younger and younger, and can't emphasize enough the importance of your diet. There's a whole movement on food is medicine.
Let me ask you a question, Dr. Hines. And I have a very close relative. In fact, I'm married to her. And the only
That's
physician,
close.
the only physician that she has is her OBGYN. Is that
So
a good idea?
So an OBGYNs play different roles in different communities. In some instances, they are considered part of the primary care provider network, right? Because it depends on how far your OBGYN is willing to go and what things they're willing to test for, right? So there are some OBGYNs who will absolutely, order you a colonoscopy, who'll check your cholesterol and your thyroid and things like that. And then there are some who have a narrower scope of practice, but in general, OBs are often included in the context of primary care providers, and then you just have to understand what your OB is willing to do or not do.
Do they know how to auscultate your heart? Usually.
They did go to medical school, right? And again, they do, right? So there's a lot that the OBs. I'll be my OB was my only primary care provider for a while, up until I got to the age where I needed to start doing some of these other screenings, and she said, I don't do that. So then I had to go get somebody else.
Okay.
But
Let
for
me,
a lot of women, truly, for a lot of women, their OB is their PCP for a good while. That is a very common occurrence.
what do you think about that, Dr. Walks?
Well, I think that whatever doctor is going to take the time to understand your particular concerns is better than a doctor with a lot of titles or the right specialty or what have you. I was talking with a patient on Friday who was frustrated because this person needed a lot of different kinds of healthcare coordination, needed to coordinate a neurologist with a cardiologist and what have you, and felt like their primary care person wasn't really getting the information. To not go too far off the message, but the same doctor can prescribe a particular medicine for very different things. And so it's not just because you have a list of medications doesn't mean that you know exactly what your doctor is prescribing everything for, and then a different doctor prescribes something different that may interact with it. So no, if you have an OBGYN doctor that really cares about you and knows your history and is keeping up with things, hey, hold on to that one, because you might find a different kind of doctor that isn't going to be able to or willing to or too busy to manage a lot of the stuff that you need.
Ms. Romero, anything to add from New York City, New York, upstate New York? How does it go there?
Well, since I currently live in California, I can only speak on my past experience in New York. But you wouldn't think that nurses can have a lot of impact on, you know, cancer treatment or preventing cancer treatment in younger patients. But you were speaking about time, and nurses often have a lot more time to spend bedside with patients, gaining their trust and having conversations with them about their lifestyle, what changes that they can make to their lifestyle. You would be surprised at the relationship that we're able to build that physicians don't necessarily get to build. And the other thing that you were talking about is when there are a lot of different healthcare providers collaborating that aren't necessarily speaking to each other, the nurse can provide a bridge, especially during the admission process when we're going over medications and possibly talking about medications that they were on that don't necessarily need to be on anymore, or maybe that we're missing, and why isn't this patient responding here in the hospital? And then once the nurse possibly reviews their home medications, we figure out that, hey, they're not taking this medication that they normally take at home, and then we can communicate that to the providers and see better results.
Very good, thank you. Let's go to the next slide, Simon. Microplastics. That sounds like something that a psychiatrist would know about, right?
Absolutely. Uh, so since I don't see Dr. Lawson yet, um, I will do my psychiatric best. I, the first point I'll make about microplastics is that I thought I understood about microplastics until I read something a little while ago, a couple of days ago, I think it was, when they said that the numbers that were in the initial study that made everybody need to throw away all of their black plastic food containers, that the number wasn't as high as they thought it was because somebody put the decimal point in the wrong place. So the amount of danger from microplastics is not as high as they thought. And I said, wait a minute. this is kind of an okey doke. Is there any amount of microplastics that we want to add to our diet? Is there is there any good amount? Is this is not strawberries where you want to, it's okay to have another one. So I think that because we're in a in a community, a larger community where everybody wants to have their own truth and their own science, and this is bad and that's bad. I think microplastics, most folks would agree, are not the best thing to put into your body. So, what are they? Tiny, just what they sound like. Tiny plastic particles found in water, food, air, and soil. So tiny, they're called microplastics. We can't see them. We can't just say, oh, I looked up and a microplastic particle flew by. So the environment and what we do makes a lot of difference. So health risks. They enter the body through ingestion, contaminated food and water, or inhalation, which means they're airborne. They're associated with hormone disruption, inflammation, and cancer. So actionable advice, because we are about actionable advice at Black Health Trust. Reduce plastic use, switch to reusable items, reusable water bottles, shopping bags, avoid plastic packaging for food if you can, drink filtered water to reduce the exposure. It's hard to do it, to deal with stuff that you can't see. I can avoid, the quarter pounders with the contaminated chopped onions, diced onions. But when we look at things that we depend on in our environment, it's really important that we talk about these things and raise awareness. I mean, every time you go someplace, they're putting your food in a plastic container. So,
So, so somewhat related to this, I had a conversation with Miss Romero, who had a friend who was a plumber, and she cautioned me about drinking water, hot water, out of the faucet. You want to speak about that a minute? I know this is not exactly microplastics, but what were you telling me?
So I've had the experience of working with a master plumber replacing hot water tanks in people's homes,
mm,
um, as a summer job, you might say. But in the process of taking a hot water tank out of somebody's house, you have to empty the water. And the bottom of these tanks are filled with sludge that is rust and dirt and minerals. And it does typically sit at the bottom of the tank, but it mixes with the water in the hot water tank. If you've ever filled up your hot, your pot to boil some water for pasta or even a teapot, and you filled it up from the hot water, hoping that your water was going to heat up faster. Well, you were ingesting a lot of really, really unhealthy minerals, and it's really unfortunate that I didn't know that before.
let me just add, I looked inside of my hot water heater just several weeks ago now, when the lower element had to be adjusted or what have you. And the plumber showed me, he said, we'll come out here and drain this and clean it once a year. And I would have just said, go away. That's not required. But after I looked inside of the hot water heater that they were replacing, praise the Lord, they were replacing it. I realized that, yeah, it's the bottom inside of a hot water heater is very unattractive.
That
We should really have like stickers over the hot water faucet that says not potable water. Um, I don't know how many people don't know that and are contaminating themselves, day after day, year after year, with this water that if you see on airplanes, it says not potable. That's the
Yeah.
same. It's the same water. It's not potable. You can't drink it.
oh my goodness.
Bathe in
Just
it.
just to be clear too, so there isn't confusion. You're not, what you're saying is drink cold tap water,
Cold
right?
tap water,
Not, yeah, not don't
not
drink
hot
tap
tap water.
water. Right, yeah.
But the water that comes out of that hot water tank is
Yeah.
not potable water.
Yes, I just wanted to make sure that we said that clearly, so it
Yeah.
didn't seem like that, all the tap water was a problem.
No, but again, a concern of a healthy pipe system is things that we don't think about. I think we saw in Flint, Michigan, that their water system was being poisoned. It's more common than you think, and
Absolutely.
maybe not even just on a community level, but old buildings, old homes, asbestos, pipes that need to be replaced haven't been updated in 100 years. Um,
Yeah, water filters
where's
are
your water
important.
coming from?
Yeah.
Where's your water coming from?
Yep. Water filters are important because, especially in the context of this discussion on microplastics, right? Because if
Mhm.
I'm not using plastic bottles, right, then, where am I getting my water from, right? Then I have to be filtering it from I'm getting it from some source. Because even if you buy water, it comes in a big giant
Comes in a big plastic bottle.
plastic jug, right? So,
Unless
it,
you're willing
it,
to pay $25 for a case of glass bottled
it
water, which
right,
is, who can afford that?
right. And while also saying drink freely, be hydrated. So there's a lot of and it can be daunting, which is why I wanted to I just wanted to make sure that we said clearly it's not don't drink water, right? Because we don't,
Mhm.
it is don't drink hot water from your tap, or filtered or not, right? Don't use it as hot
Filtered or not.
water for drinking, but you can absolutely heat up your cold water and go ahead on and make your
Yes.
spaghetti like you put in and finish up, right? Your hot water is
Yeah.
for the shower. That's what it's for, right? Like,
That's what
or
for.
the bathtub or whatever.
Yes. Yep. Exactly. Unless you put one of those nice reverse osmosis, systems in your home. And again, hopefully you can afford to do that.
All right, let's go to the next slide. Thank you, ladies and gentlemen. Let's go to our next slide.
Can I just make a comment on the microplastics thing in general, though? Because the more this stuff comes out, you're finding out there's microplastics it's in the lotion, it's in the deodorant, it's in the food, it's everywhere. So sometimes, at least for me, when things like this start happening, where there's something that is, a cross contaminant that is ubiquitous, it can be very daunting to decide, well, what steps can I take? And I think for me, what is helpful is do the things that you can do. So I can get rid of my black plastic kitchen utensils. Cool. I bought my mom a teapot that is specifically designed for loose tea leaves, because tea bags also leach out the, microplastics. All your delivery food, with the exception of your, hamburger that come in wrappers, comes in those black plastic containers that, so maybe
What,
don't
what,
keep
what
those
about
for
what
forever.
about those coffee pods?
The coffee pots.
Pods.
Oh, pods. Again, exactly. I don't have one. But yes, I mean, it's all over the place. So I think it is start where you can start, do what you can do. Um, and
Are they,
no, especially for, in the discount stores, that was the other last thing I was gonna say, was in your, you know, stores, that your discount stores often sell products that have been in there, produced a while ago. Those things are more likely to have issues with, microplastics, especially when you're talking about your lotions and shampoos and all of those types of things.
like the 99-cent store?
Yep, they
Oh
don't
my
exist anymore, but yes, conceptually.
God. Okay. All right. Why don't you take this one, Dr. Hines?
Sure. Ultra processed foods. So we've talked several times over the course of this year about ultra processed foods, and ultra processed foods. They've gotten a lot of interest in the news lately, as far as being linked to some of the, cancer causing agents, inflammation, obesity, food addiction. Um, so we want to limit our consumption of packaged snacks, sugary drinks like sodas, fast foods, and focus more on whole foods like your fruits, your vegetables, your lean meats, and your whole grains. And then reading labels can help you kind of figure out if you're unsure of whether you're talking about ultra processed food in general. The more words that are on a label that you don't know or can't pronounce, the more likely it is that you're talking about something that has been ultra processed.
Dr. Walks talked a while back about how to shop in the shopping market, about shopping around the edges versus the center. Did you speak about that, Dr. Walks?
I did speak about that. A lot of the things that we recommend that folks eat are in that around area. So, the produce department is never in aisle 8 of 16. It's usually on the end on aisle number 1 or what have you. And so I just think it's important to this word, the first word here under actionable advice on this slide is limit. We want folks to limit it. Ms. Romero made a very important point earlier about those few people that can afford the $25 glass bottle case of water. We have a very difficult time with some of the pricing on some of this stuff. And then you find that if you do get the high end stuff like the raw unprocessed stuff, then it's going to kill you because it hasn't been kept properly. So things are growing in it. It's just not. Oh, by the way, nothing grows in a can of Coca-Cola.
But
It'll kill
Coca-Cola
every it.
will clean your pipes, right?
It
Yeah.
might it might kill you, but it'll kill whatever tries to live in there. I mean, it's so to be real about it, we are really advising folks to be aware, to limit the consumption of ultra processed foods. And at the same time, we know that it's a hard thing to do, and especially in many communities where the supermarket is not within walking distance and you don't have a car, and sometimes you got to get on 2 different buses to get there. So we're trying to raise awareness to the point where whatever I'm able to do, I'm thinking about trying to do it. No, I can't avoid the plastic water bottles, but I'm thinking that maybe I can do this or that. No, I can't do this. I live in a place, old buildings we talked about. We didn't mention lead. Lead pipes are really, really a bad thing, especially for young kids when the water comes out of lead pipes, right? So I just want to, give that word of reasonableness to all of this. It's all important. It's
Is Dr.
all relevant, and do all you can.
Is Dr. Sherrod on?
I don't know. Yes,
Yes,
Dr.
he's
Sherrod
there.
is on.
That's right. I know you want to comment on ultra processed foods. Is she unmuted for a
She, she
brief?
is not unmuted yet.
I put this in especially for her. That's just right. Well, let's go
Well, I
to.
know I know Dr. Sherrod. Oh, there we go. Go ahead, Dr. Sherrod.
Yeah, good afternoon. Unfortunately, I have not heard the whole conversation. I was just able to come on just now, so I don't know exactly.
We just were cautioning people about ultra processed foods and how they can affect your health in a negative way.
Yeah, they are not good for you.
Okay.
It's like eating, well, the nutrients are compromised, and then we have all of these other ingredients in the processing process. You know what I mean? That you have to deal with, which usually are chemicals, and they are not equal to nutrients for the body.
Right.
We really should lean toward fresh vegetables. I mean, even leftovers, I think that's another thing that people need to talk about. Leftovers have no nutritional value.
Well, thank you so
And
much.
America goes on leftovers quite a bit, because of our lifestyle. So those are things that you need to consider. If you can't read the ingredients and understand the ingredients on the packaging, then you probably should not consume that product.
And the other reason I wanted Dr. Sherrod for a moment, I want to congratulate her. She got an award about a week ago called the Imhotep Award, being one of the outstanding physicians in the country. And I want to congratulate her on that. Dr. Sherrod, thank you so much. Let's go to the next slide.
Thank you,
Excellent.
Dr. Maxey.
Dr. Walks, I was looking for Dr. Lawson and you to speak about this.
Okay, I will try to hold up my end, Dr. Maxey. Food and Alzheimer's disease, some new insights. Diet and Alzheimer's. Research suggests that the Mediterranean diet, rich in olive oil, fish, and vegetables, may lower the risk of Alzheimer's. New treatments, monoclonal antibodies, such as the one on the screen there. Don't try to make me read all these big words, Dr. Maxey. Offer hope for slowing down cognitive decline.
Let's go to the next slide and I think it'll finish that up.
Actionable advice. Emphasize a diet rich in antioxidants, berries, leafy greens. Keep mentally active and socially engaged. Early detection through biomarkers and genetic testing.
Why are all these
Emily?
things saying the same things, Dr. Walks?
I'm sorry, say again?
Why are all these slides saying the same thing for everything?
Because I think we spend a lot of time talking about avoid this, avoid that. And really what we're talking about, and the reason a lot of these slides say the same things, is that there really is a way forward that's pretty clear. It's not as complicated as sometimes we think it is. It's not so hard to know that when I'm shopping, I want to try to get the fresh stuff and the stuff that's not vacuum packed tightly in plastic and has a sell by date that's a year from now. That's probably not the best thing for us. So if we just took all these slides and made them very simple and said, let's talk about the way forward. Let's talk about the things that we want to do and the things that we want to do as much as we can do. I think that's the answer to why a lot of these slides are. The other answer is something I learned back in elementary school. If you want them to learn it, repeat it. That's another reason these slides have a lot of the same advice, because folks need to hear things more than once in order to make them part of the conscious decision-making process.
So Dr. Hines, as one of us who's the furthest away from Alzheimer's disease, I want you to comment on this.
I think Dr. Walks's point is spot on, right? Because rather than sitting around thinking about, oh, I'm following the MIND diet, because the MIND diet is it's like a combination between the Mediterranean diet and the DASH diet. And then what's in the Mediterranean diet. In essence, they're all the things that we already knew, right? That we pretty much grew up with kind of directly or indirectly. And we already knew that fruits and vegetables were healthy for us. We already knew that nuts and things were healthy for us. We already knew that, the red meats and the porks and the butters and the fried foods, and not so much, right? Like, we already knew these things. And just because we gave it a name doesn't have to make it complicated. And then the other thing, as we talk about, some of these things that seem daunting, because a lot of the pushback you get is, well, we all gonna die anyway, right? Because you were giving such a comprehensive list of things, don't do this, don't do that, don't eat this, don't eat that. Trying to not buy processed food, like trying to not buy ultra processed food is particularly challenging. Like, it's difficult. Like, man, bread is in that category. Bread, like, I gotta turn into a baker and make my own bread. Like, that's not realistic. But while we are all going to die at some point in some way or way or another, we can feel better while we're alive. And
Amen.
So I've got a trick question for Ms. Romero. Tell me about linguine and clams. Is the pasta bad for you? Is the clams bad for you? What about that? And does the garlic help?
Well, I think that the clams themselves are not bad for you, but pasta, we know, is really just bread, and a lot of people tend to eat bread with their bread. So it's a little bit redundant. But I did just want to make a point that I noticed your question on the bottom. The discussion prompt was, what dietary changes can we make as a community to protect our brain health as we age? That's a great question, but I think another good question is, what changes can we make in underserved communities that are overrepresented, with a lot of health, issues, but underrepresented as far as having access to these healthy foods that we know about, but knowing about it doesn't give you access to it. So how do we help these people get better food, so they're not experiencing Alzheimer's early, or their kids aren't experiencing food uncertainty, which we know when these kids go to school and they don't know when their next meals are coming, they don't perform as well. There's just so many effects of not having a proper diet and access to nutritious food, as well as healthcare. And that is seen across all these slides, the food and Alzheimer's, the climate change, how it's affecting food scarcity, and just underrepresented populations, and how it really affects them, or us, all of us.
Well, thank you so much. And when Dr. Walks comes out to visit, I'm gonna see how we can get him some linguine and clams. Let's go to the next slide. We're at the top of the hour, so we got to keep moving. So, obesity is now known now as the disease of the brain. And the key points here that obesity and brain health. Obesity is increasingly seen as an illness of the brain, and it's also influenced by genetics and the environment, as well as your behavior. So neurobiological factors, changes in the brain regions involved in hunger, reward, and I know the ventral medial nucleus is one of the control centers for hunger. Let's go to the next slide. And we also know that medications like Ozempic, which is semaglutide, can help regulate appetite. And all the articles coming out now that just exercising and eating right will not in and of themselves treat obesity. That we do need these drugs like semaglutide and some of the other content that are coming out. Is something that it doesn't only just limit the outlet of the, the gut and keep you full, but it also affects your brain, and also helps with your cardiovascular health. And there are many lifestyle changes that we want to use in addition to those drugs. So let's just speak about that a moment. Because the word brain is in there, Dr. Walsh, you can make a comment.
Yeah, I would like to make a comment about this in particular, Dr. Maxey, because I was listening to an interview with someone who is a high up person in the fitness industry, who was saying that they were concerned that with the semaglutide medications and what have you, that they would see a drop off in gym memberships. People wouldn't be coming. They would just figure, I can just sit at home and take these drugs and lose weight. And what they're seeing instead is that people are continuing to come to the gym and continuing to exercise because the focus isn't on, I'm going to lose weight and not be fat. The focus is on, this is part of my overall fitness journey. So, yes, it is really important. Again, positive messages are much easier for people to tolerate. And if I can talk to someone about becoming more fit, and as Dr. Hines said earlier, you know, living longer and being good at it. You can really get good at living longer. You can get stronger, you can have better balance, you can find ways to not pull a muscle every 5 minutes, and so you can enjoy being a little bit less young. So that's part of the, let's talk about it in a way that helps us to engage, as opposed to stop telling me all the bad things I'm doing. I know I'm doing bad things, but engage me in a way that encourages me to do some things that are better for me.
Okay, thank you. I know we're getting close to the top of the hour. Let's go to the next few and then we can make final comments. So I'm going to ask Ms. Romero to speak about this one. Read this slide.
You're muted. Still muted.
I
There
was
we go.
saying I'm not sure that I really know that all that much about parental stress, but I think that's something that we can really all relate to. Um, as far as being a hidden epidemic. The rise in parental stress, definitely modern parenting, creates economic pressures as well as work-life balance. The efforts to keep our kids safe from social media are contributing factors to high stress levels among parents. We talk about how social media is affecting our kids, but it affects our parents just as much as it affects the kids. It affects the parents just as much as, and if not more. So parents, therefore, are experiencing more anxiety and depression and physical health problems like hypertension and weight gain and diabetes and heart disease. All of these things are increased by parental stress and this modern society that has our kids you know participating in so many different activities that therefore the parents have to participate, and all the money and expenditures that's taken out from the family, and it gets to be a lot.
Why don't you continue on the next slide?
So what kind of advice that would be given for parents? You can practice mindfulness, stress management techniques, seeking social support and professional help when needed, uh, putting focus on building supportive environments for parents, and asking questions like what resources are available within your community that help with stress, and how can you participate.
I think I read something over the weekend that some European country or countries plural put a ban on social media for below the age 16. I don't know if you've seen that or not.
Mhm.
Yes, I have. Congratulations to them. But one of the things I also found challenging about being a parent is as soon as you find a way to curb something or put a limit on something, there's something else popping up that you don't know about, and it's you really have to be on your toes.
Dr. Hines and Dr. Walsh, what do you think?
Everything I agree. Yes, still in the thick of parenting and all of the things, right?
Yeah.
There are, everybody always say, all the parents always say, oh, you don't think it was that different when I was a kid. I honestly, I think that they're winning yeah, things were different. This is different. So I think they actually do get to win the award, that they're facing some different things at way younger ages than conceptually, even if it wasn't the exact same thing, then some of the concepts that they're faced with are not things that any of us grew up with
The
during that formative time in our lives.
last thing I'll ask on this question: how damaging, or is he damaging at all? Is a guy named Elmo?
I'm
What is wrong with
Yeah,
Elmo?
I'm not familiar with the damage of Elmo.
I don't know if he is. Maybe he's good. Let's go to the next. You want to take this out to Dr. Hines?
Sure. Bird flu mutation and pandemic risk. So while the bird flu primarily affects poultry, mutations in the virus could make it more transmissible to humans. I think we've already seen a few cases of that this year. And if the virus mutates, it could cause a new global pandemic with severe respiratory effects. I think, again, as we're talking about this, this is closer to the end. You know, climate change, right? And the ways where as viruses move differently, as animals move differently, there are our bodies are, as humans, we're going to be introduced to things that we haven't seen before, and because we haven't seen them before, there's certainly the risk that as a population, it can cause significant effects for us. So
Take that slide. There's another slide behind this.
Okay. So actionable things that we can do is stay informed through health and organizations like the CDC, which is the Center for Disease Control, or the World Health Organization, WHO, support vaccination programs, and continuing practicing, good hygienes. I know in this area, COVID is back on the rise again, but the reality is, we shouldn't stop washing our hands. It should have been a lesson to us about the importance of continuing to wash our hands, to stay away from sick people, stay away from sick animals. If you know that the animals are sick, don't go touching strange things, strange animals just because they're cute.
Guilty.
Yeah.
Go to the next slide. We're close to the end.
And then I can do it. Brain activated computers, new frontiers and technology. So health benefits. So we're talking about, artificial intelligence, new revelations with regard to artificial intelligence are coming out every single day. And there's a potential in the health space to aid people with physical disabilities such as paralysis and severe motor impairments. And then there are also plenty of ethical considerations and concerns as we introduce more machine learning and artificial intelligence into the healthcare system. There's privacy concerns, there's accessibility concerns, there are implications for cognitive enhancement technologies. There's a lot, and it's happening fast. There's a lot happening very fast in the merging of healthcare and technology.
Let's go to another slide behind this.
So what you want to do, you want to make sure that you stay informed about new technologies and their potential impact on healthcare. Because again, some of these things are really positive. I remember we talked specifically about mammogram screening and how increasingly they are AI assisted, the interpretations of the images. And then you want to support ethical research into the development and regulation of BCIs. I think in addition to support ethical research, I think for what it's worth, you are absolutely going to want to pay attention to what our government is proposing or not proposing to do as far as the regulation of these types of technologies, and make sure that you are talking to your representatives so that then they can hopefully represent the things that are important to you in that space.
And I think we have one more. And these are computers that actually help you move. You can think, and it will work your computer. You don't have to touch it with your keyboard and mouse.
So, yeah, there's brain chips, and again, that is just one iteration of how those things can be done. There's a lot going on right now with robotics, with artificial intelligence, with trying to make computers that can think on their own. What it means for humans, what it means for jobs, what it means for society. There's a lot happening.
And Dr. Walsh, if you take these last two.
Conclusion. Past years brought us new health challenges, from climate change and cancer to the risks of modern technology and lifestyle. Actionable steps. Make small, sustained changes in daily life. Changes in diet, environment, and stress management. Support community efforts to raise awareness and promote healthy living.
There's another slide behind this, I think.
Final thoughts. Stay proactive in learning about health risks and be part of the solution in your community. Stay alert, attentive, aware, preventive, and woke.
Thank you so much. I appreciate everybody. We're a little bit over time, but let's have final comments. We'll start off with Ms. Romero. Final thoughts and comments?
Thank you, everybody. I really appreciated everything that I really learned today. Hopefully I can take some of this information to improve my practice and outcomes with my patients. Thank you again.
Thank you. Dr. Hines.
I think the conclusion slide was spot on. We covered a lot, and as we kind of did this year in review here, I think that find some places where you can take action, and then continue to be aware and keep paying attention to what's going on, and double check, right? When you see stuff come out, double check, especially as we go into this new administration, double check to make sure that what you're hearing is actually credible and factual. And Happy New Year, everyone.
Thank you very much. Dr. Walks.
I'm gonna be the old man in the group and say I remember a time when everybody used to go to the Encyclopedia Britannica for all of their vetted truth. If it wasn't in the encyclopedia, forget about it. And now everybody has their own truth. And so it makes it even more challenging to know exactly where to take advice. Entities, organizations, opportunities like Black Health Trust are a good place, I think, to get advice from folks who really want to give good advice. And then I think you take what you hear here as sort of the preamble to your own work that you do, where you go and you read a little bit more and understand some of those big words Dr. Maxey puts in the slides. Look them up. And I think if we can help folks to become interested in learning, and as Dr. Hines, I think, just said, if we can all just become lifelong learners, just be interested in knowing new stuff, I think it's just useful. It makes sense because things are changing so fast. And unlike the young Dr. Hines and the young Miss Romero, I'm afraid of AI. I keep watching those Terminator movies. I think Skynet's coming to get me, and and I'm going to hide behind Dr. Maxey. So that's my final comment.
Well, thank you so much. We miss Dr. Neighbor Stevens. We hope she's enjoying the country of Sweden and her family over there. Her daughter is married to somebody in Sweden, and we wish her a safe return. Thank you, Dr. Walsh, for all that you've done. Thank you, Dr. Hines, and thank you for joining us today, Ms. Romero. Thank you, Simon, for all your help in putting all this together, and Happy New Year, everybody.
Happy New Year.
Great day.
Bye.
Bye-bye.